today is about classifying animals according to the body coverings. Okay. Who wants to read about our lessons for today? Okay, Aisha.
Noon po, kala ko lang po normal yung paningin ko kasi po medyo malabo po yung pagtingin ko sa mga letra. Tapos po pupunta po ako sa harapan para po makita ko po yung mga nakasulat sa blackboard po. Tapos paminsan po nagtatanong po ako sa klase ko kung ano po yung mga nakasulat sa blackboard para po diretso sulat ko na lang po sa notebook. Kaya po noon, kaya po baba yung grades ko kasi po naaksaya po yung oras kasi po babalik-balik po ako sa unahan, tapos po, hindi ko pa naman tapos yung mga gawain. Kaya po kung ano lang po yung nasusulat ko, yun lang po yung nag-chat.
All parents, even us teachers, want to see children reach their full academic potential. But we might overlook one important learning tool, a child's vision. This video will help you understand common eye problems affecting school-aged children as well as the importance of conducting vision screening. The demonstration will guide you on the proper procedure in conducting vision screening and management of children with vision problems.
The objective here is really to catch the children at an early age if they have refractive errors. And if they have, then it's better to correct it as early as possible because we want to prevent amblyopia development. Well, if we test the children and if there's, let's say, children with one eye has a higher error, then that eye with a higher error can develop amblyopia or what we call lazy eye.
Vision screening done at early age would allow detection of problem when treatment is still possible. Remember that vision screening is not a diagnostic procedure or a complete eye examination. It only aims to know children who are at risk of having vision problems and those that may require further examination by an eye specialist. Vision screening should be performed among kinder, grades 1, 4, 7, and 10. Various types of charts can be used in the screening to measure the visual acuity or the ability to see clearly in various distances depending on the age of children and availability of the chart. It is recommended to use the Leia symbols chart when conducting a vision screening for preschoolers. Before the screening, make sure you have all the materials needed such as the Leia chart, response key, occluders, and a 10-feet string. The screening should be done in a quiet, undistracted, and well-lit area with at least 10 feet of testing distance. Sufficient chairs should be placed outside the screening area where other children can wait for their turn to be screened. The Leia chart must be placed on a plain, neutral-colored wall. In case the wall is patterned or cluttered, put a neutral-colored paper background. Place and secure on the floor the 10-feet string with one end from the chart and the other end to the position of the child's chair. The child may stand or sit on a chair, provided that the Leia chart is at the child's eye level. If standing, the back of the child's heels should be positioned at the end of the string. For this demonstration, the child will be sitting so the string must be aligned to the back of the chair. The back of the head of the child must also line up with the end of the string. Put chairs beside the chart for the screener, beside the child for the recorder, and beside the recorder to place all the materials needed for the screening.
Sino gustong maglaro? Yan, very good. Sinong alam ang larong matching
Prior to
tag?
actual screening, it is important to prepare the children as it helps promote cooperation and participation during the screening process.
Imamatch lang natin. Pag tinuro ni teacher
Explain the
to,
screening procedure by saying that you are going to play a matching game instead of saying vision screening or eye test.
So, at familiar ba kayo dito? Familiar? Ano kaya ito? Bilog?
Familiarize the
Ito.
children with the shapes or symbols.
Ay, ito.
As long as the child is consistent in naming the symbols, he or she can be allowed to use his or her own words to describe them. We are now done preparing the children for the screening and setting up the area. Let's start with the actual screening. Once the child is seated, present the transparent response key.
Kung ano ituturo ni teacher doon, ituturo mo rin dito?
First, determine whether the child understands the instructions of the screening or not by having the child identify the 4 symbols at the top of the chart or the 1050 line with the eyes uncovered. Do not coach the child by asking if the symbol is a square or a circle. Child points to the response key. Always give positive comments whether the child identifies the symbols correctly or incorrectly.
Ikot ka naman. Okay, ngayon titignan natin kung may tuturo mo yung mga shapes pag meron ka ng salamin.
If the child fails to identify the symbols, have them come closer to where he or she can see the chart and recognize them. This will allow the screener to see if the child understands the instructions or sees poorer than 1050. Thus, at this stage, the child failed the screening. Annotation on the screening form less than 10/50 can be made. If the child identifies all the symbols, proceed with the critical line screening. Occlude the left eye and screen the right eye first. If the child turns his or her head sideways during the screening, reposition his or her head so that the eyes are directly looking at the chart. Make sure that the child does not peek, squint, lean forward, or tilt his or her head. By doing so, the child failed the screening.
O ano yung unang tinuro ni teacher? Turo mo nga sa akin, anak. Ayan.
Ask the child to identify symbols on the right eye test line appropriate for the child's age.
Wow, ang galing mo pala. Okay, next naman yung sunod na mata ha. Tingnan natin ha.
Repeat the same procedure for the left eye using the left eye test line.
Ano yung tinuro ni teacher? Very good. Oh, yung sumunod. Galing ah. Ayan. Okay. Very good. Okay. Wow, very good naman si Prince.
Finally, record the result using the prescribed form. Put a check mark on the pass or fail column. If the child fails, indicate which eye failed. The child passes the screening if both eyes correctly identify 3 out of 5 symbols. If one eye or both eyes incorrectly identify at least 3 out of 5 symbols, the child is subject for a referral to an eye specialist. Remember to always clean the equipment with antibacterial wipes in between uses or screening. If the child wears corrective lenses, these should be cleaned and worn during the screening. Position the occluder over the eyeglasses. The Leia numbers chart can be used for children 6 to 7 years old and older, or when they know numbers by following the same procedure we just did with the symbols chart. Again, both eyes should identify 3 out of 5 numbers to pass the screening. Some children may need rescreening. It should be performed ideally within 6 months to eliminate children who failed from the initial screening. Rescreen a child if he or she was unable to follow instructions, he or she was overly distracted during the screening, or a child who didn't complete the initial screening. If needed, the assistance of parents may be requested during this process. Alternatively, we can also use the E-chart or the shape chart for this age group. The E-chart contains rows of the letter E where the child has to specify which way the limbs of the letter E is facing. The child may use his or her 3 fingers formed as letter E, or you can let the child hold a cutout of letter E and ask him or her to position them according to what is seen from the chart. The shape chart consists of circle, square, and triangle. Children will match the shapes pointed by the screener to the provided form sheet or cutouts. Screening procedure for these 2 charts is the same with the Snellen's chart. The Snellen's chart contains block letters on 11 lines that decreases in size from top to bottom line. Now we will show you how to do a screening using the Snellen's chart. But before we do that, there are also important things we should do before conducting the screening. We have to make sure that the chart is posted with its 4th line at the eye level of the child. It should be on a blank wall devoid of decorations, markings, or posters with sufficient light and no glare. The space in front should be spacious and free from obstructions. Measure 20 feet from the chart to where the pupil will be standing during the test. A line or mark must be drawn on the floor. To be able to ensure the reliability and validity of the vision screening results, do not post or display any eye chart inside the classroom. After setting up the screening space properly, we are now ready for the actual screening. Children should be screened individually. Let the child stand with heels touching the line, or sit on a chair with the back legs of the chair touching the line. If seated, make sure that the child is sitting up straight. Each eye should be screened separately. Start with the right eye. Cover the left eye with an occluder or an eye patch or a piece of cardboard. Instruct the child how to do the screening properly. Make sure you point the letters randomly for each line. Use a pointer, not a ball pen or a pencil. Starting from the top line down to the last line.
P,
Stop and record on the row that the child cannot read correctly. Repeat the same procedure with the left eye. Record the result as either pass or fail. The child passes the screening if both eyes are able to read on the 20/20 row. Otherwise, the child failed the screening. Again, if the child has eyeglasses, screen vision with it. The screener can already identify signs of possible vision concerns by observing the appearance of a child's eyes, watching his or her behavior, and noting any complaints from the child during a performance of visual tasks. Observe if the child's eyes are misaligned, shaking, red, watery, or encrusted. If he or she has drooping eyelid and styes. Check if there is presence of a white pupil and any eye injuries resulting in bruising, swelling, or bloodshot eyes. Note also if the child is squinting, frowning, blinking or squeezing the eyes, thrusting his or her head forward or backward while looking at distant objects, rubbing their eyes, turning and tilting the head to one side during visual tasks, placing the head near to a book or desk when reading or writing, and closing or covering one eye, especially in bright light, must also be observed. Children or their parent or guardians should also be asked about complaints such as headaches, eye pain, nausea or dizziness, burning, scratchy or itching eyes, blurred or double vision, words that move or jump when reading, and unusual sensitivity to light. Observation is not a test. However, the presence of any of these signs is sufficient reason to refer a child for a thorough eye examination by an eye care professional. The clinic teacher must submit the initial report of the screening to the division office. This will allow the division nurse to conduct further screening, validate the result, and issue a referral for further evaluation. For children who fail the screening, immediate interventions must be done. Make sure the child is moved to the front seat of the class. Give the referral letter provided by the division nurse to the parent or guardian within 1 week after the screening process, informing them that the child has failed the vision screening and that a complete eye examination by an eye care professional is needed. We, teachers, and the school management committees play an important role in implementing effective vision screening. It is better that school teachers undergo training using vision charts and that they develop a school-wide vision screening plans. Vision screening should take place once a year, conducted by clinic teachers. Prior to vision screening sessions, teachers should inform children about its purpose, how it will be conducted, what problems may be identified, and what will happen if a problem is found. With a prescribed form, teachers should record all children identified as having vision problems. It is also our responsibility to inform the parents or guardians of children identified as having vision problems. With the full support of school management committees to teachers and parents, compliance with the treatment or management program prescribed for the child at school will be ensured. Vision problems can occur without the child, their parents, or as teachers noticing them. Make sure to observe the appearance of the children's eyes and note any unusual behavior or complaints while doing a visual test. So the earlier a problem is detected and treated, the more likely children can perform well in school.
Masaya po ako kasi po, binigyan po ako ng test sa mata dito po sa school. Tapos po, dun po nalaman na malabo po yung mata ko kasi po, di po ako nakapasa dun sa eye chart po. Pina-check up po ako ni mama sa mata kasi para po magawan ako ng salamin. Hindi na rin po ako nagtatanong sa kakasi ko kung ano po yung mga nakasulat sa blackboard po kasi po may salamin na po ako.